Instead of meeting, but then
all day interviewing nurses to take.
good morning, members.
Morning.
Morning, how are you? I think we can start our today's webinar. Welcome to our 28th webinar, our monthly webinar under the Water Resources Institute that always held every month at the last Friday of the month. And today's webinar is going to be focusing on assessment of groundwater quality in the Rhino and Imvepi refugee settlement in Northern Uganda. And knowing that Uganda is a host of almost about 1.3 refugees, we are being a host of refugees for several times, and our policy of refugee hosting or refugee status, we allow them to integrate with the communities they are living in. So in this process, the refugees are always part of the communities they are living in, and they are migrated and also be able to even to acquire land and dig and grow food. But mainly the water resources being supplied in the refugee settlements is groundwater. Knowing that groundwater compared to surface water, the quality is relatively better compared to the surface water. That's why the water supply in the refugee settlements or in other rural settlements is mainly groundwater. It has better quality in terms of physical chemistry. It has better quality in terms of bacteriological. But in some cases, because groundwater is a factor that comes through what they call geology of that state, or what they call, I would say, the hydrogeological or hydrogeological of that area. If the aquifer is acidic, or if aquifer has high levels of minerals, then the groundwater will also have that high level of minerals. But if the aquifer is of the soft water quality, then we find also the groundwater will have a good physical chemistry. But I don't want to go through into this explaining because I've got an expert that's going to take us through this webinar. And the next part is by the names of Barnabas Mubanjizi, who has got about 10 years experience in water quality, in laboratory management, and laboratory system management, and has been working with the Ministry of Water for about more than 7 years. And I'm sure Mubanjizi will tell us what he found out in these 2 refugee settlements in the Northern Uganda and what he got out of the assessment of the water quality of these refugee settlements. He did about 50 groundwater sources to come out with the results. It's a study that is under the Ministry of Water and Environment. And we hope that this webinar will be able to inform the listeners and the participants here understand what happens in the case of the water quality in the areas. Because water quality doesn't mean even though it is groundwater, it cannot be polluted. If the environment, if the catchment is polluted, it can also end up reaching the groundwater source. Although the groundwaters may be underground, but if it is like 10 meters deep, the chances of being polluted are high. If there are deeper wells, maybe the chances are limited. But we pray that our groundwater sources are effectively protected and effectively and efficiently exported for the goodness of the nation and the goodness of the community and the population of Uganda. On this note, I want to welcome Barnabas Mubanjizi to take us through the presentation on groundwater assessment in the 2 refugee settlements. Thank you. Thank you, members. Barnabas, the floor is yours.
Thank you, Madam Gwen. I hope you can hear me.
Yeah, I think members can hear Barnabas. I think they will.
Yeah.
Yes,
please.
I can hear him.
Okay, thank you so
can hear
much.
him.
Go ahead.
Sure.
Okay, thank you so much, Madam Gwendolyn, for that generous introduction and also for pointing out a few issues here and there on groundwater. I'll be able to take you through the presentation. but you give me a minute so that I can share my screen. I guess you can see my screen now. Shared?
Sure.
Okay.
We can see the screen, Barnabas. Thank you.
Okay, thank you. Madam Gwen has already given a good background on this topic, groundwater quality assessment and human health risk assessment in the Rhino and Imvepi refugee camps. So we are going to go through this topic slowly by slowly. We got a chance to do this assessment with funding from the UNICEF. It was a larger project, but then we had a smaller assessment also done on water quality assessment, and the findings that we got were quite interesting. And we felt that we could share them across on different fora. We shared the same presentation during the Water Week, and over and over again, we have been sharing these findings just for awareness raising, and so that people can get to know what's happening with the groundwater sources, but also to think together what interventions can we make to make sure that we are safe. Okay, I've already been introduced. My name is Barnabas Mubanjizi. I work for the Ministry of Water and Environment, and I'm deployed under the Lira Regional Water Quality Laboratory, where I head the operations of the day-to-day work of the laboratory, but also make sure that field investigations, field assessments are conducted within the Northern region as regards to water quality management. As of introduction, already Madam Gwen has already hinted that here in Uganda, we have an open door policy to refugees. And by 2023, Uganda's population of refugees was estimated at 1.6 million refugees. And this number is quite significant because it accounts for 3.5% of the total population of the country. And the influx of refugees into the country was higher in October 2022. So we had a refugee of influx of about 9,800 new refugees in the country. And if you recall so well, this is the time when there were some political unrests in DRC, when the M23 group, tried to attack Northern Kivu. That's when we had the highest number of refugees in 2022 moving into the country. Rhino and Imvepi refugee camps are part of the ones that which we are doing under this assessment, and they are part of the refugee settlements that we have within the country. Okay, we have quite a number of them, but we have Rhino and Imvepi. Rhino has a population of approximately 140,000 refugees, and Imvepi has more than 65,000 refugees. Both these camps were established in response to conflict-related displacement from Southern Sudan. Just a minute. Okay, so these were established, due to conflict-related displacements from Southern Sudan. But currently, we also have some refugees from DRC settling there in these refugee settlements. This refugee influx, like already highlighted by Madam Gwendolyn, causes strain on infrastructure, on water, on the water resources, on the environmental resources, and so many social amenities, because they come in and then they have to share with the host communities who are already existent. And really the host communities are complaining that the resources are not enough, but again, the refugees come and, cause more strain to them. And according to the UNHCR report of 2023, groundwater is the primary drinking water source within the refugee settlements. Again, Madam Gwenred has already hinted on this. So that's why we really need to understand its quality. We could be thinking that we are actually helping, yet actually we are not, we are only causing diseases. And the most common sanitation infrastructure used are pit latrines. And the coverage had improved to 36% by 2023, according to the UNHCR report. So you can see they mostly use pit latrines and soak pits to manage their sanitation waste. And of course, this also poses a risk to groundwater contamination, since there can always be some seepages in case the groundwater source is near the latrines or soak pits. The problem statement is that the problem and the rationale in the groundwater in the Rhino and Imvepi is increasingly polluted due to both human activities and natural processes. This one we know quite well that for groundwater, usually we have some natural processes that might contaminate, especially if you find like the aquifer is rich in certain minerals. You also find them in the water, but the bad thing is when you find that the minerals which are there are dangerous, such as arsenic or manganese or what. When they are dangerous, then you know that some people also take water that is, a bit polluted by those minerals. And but there are also human-induced activities, such as the wide use of pit latrines, unsustainable agricultural practices, and poorly maintained infrastructure. These ones were also common in the Rhino and Imvepi refugee camps. So poorly maintained infrastructure leads to pipe corrosion and seep buildup, and this one increases the contamination risk for heavy metal and microbial contamination of the water sources. Despite the critical reliance on groundwater, there is insufficient regular water quality monitoring data that is available, and this hinders timely and evidence-based interventions. So therefore, in this study, we focused on, trying to generate more data such that it can help us to take more informed and targeted interventions on water sources. But also under this study, we tried to identify the key contamination sources for our groundwater sources, but also evaluated health risks that are potential health risks for the people who are consuming or who are dependent on these groundwater sources that have some level of pollution. The objective of the study, the main objective was to assess the quality of groundwater and evaluate the potential health risks associated with its consumption in the Imvepi and Rhino refugee camps. And the specific objectives, we had 3 of them. The first one was to analyze the physical, chemical, heavy metal, and microbial characteristics of groundwater. So for microbial assessment, we basically used an indicator microorganism, E. coli, and for heavy metal, we looked at 2 heavy metals, arsenic and lead, which are the most prevalent in the region, in the geology of the region. Then hello, can you hear me? My network is on and off.
Okay, we can hear you.
You can hear me now?
Yes, please.
Yeah, and are you still seeing the presentation or do I share again?
You share.
You need to share. Can you
Share
need to share again?
Okay, let me reshare again. The meeting. It says here the meeting host is not allowing sharing for this meeting. Could you turn it on the sharing? Meeting host. Madam Gwen, could you check with the meeting host? They need to turn on the sharing feature.
Barnabas,
Sharing is not done.
Let me follow up quickly.
Okay.
Yes.
All right. All right.
Barnabas, you can share now.
Okay, Francis, you can see my screen now?
Yes, we can see it. We can see it, Barnabas. You go ahead.
Great. So these are the main objectives and the specific objectives of this assessment. The methodology, the map you see here, this is the sampling area that we looked at, the Rhino and then the Imvepi. And then we sampled both the deep boreholes and the shallow boreholes. The deep boreholes, you can see them, they are the ones in red, the red dots. The red dots are the deep boreholes, and then the yellow are the hand pumps. So for the deep boreholes, they are mechanized and motorized. They either use their solar powered or even some use electricity for pumping water to the reservoirs and then to the distribution. And like you can see, our study area covered 50. We sampled 50 water sources, and majority of which is 34%. No, the majority is 66% were hand pumps or the boreholes, and only 34% were the motorized ones. Okay, and here you can see a list of up to 50 water sources that we sampled. Still under methodology, we applied quite a number of techniques to make sure that we get results for this assessment. And we conducted field sample collection and field testing, and also conducted sanitary surveys. And all these were guided by the World Health Organization guidelines of 2022, but the sampling the sample collection was guided by the AFA 1998. Then we conducted laboratory analysis. Laboratory analysis was conducted in mainly two laboratories. One is the Regional Water Quality Laboratory, and the other is the National Water Quality Reference Laboratory in Entebbe for the heavy metal assessment. And then when we got those results now from both the laboratory and the field, we computed the sanitary risk computation using the guidelines of the World Health Organization of 2022. And then we also tried to compute the weighted arithmetic water quality index, and also computed the incremental lifetime cancer risk. So this field activity was the field assessment was conducted in April 2024. That's when we collected the data that I'm presenting to you right now. So when you go to the results and findings, when we look at the first objective, whereby we had to do the assessment of the physical, chemical, microbiological, and heavy metal contamination of the water resources. We see this map here shows you the water quality index of the water sources that we sampled. And if you look at our legend here, the one that is very red means that that water was unsuitable, and the one that is a bit is not as red as the first one, 25 to 100, means that the water quality was very poor. So the water quality index, basically, we computed it using some parameters, and then it is able to tell you whether the water is good or poor. We use parameters such as pH, EC, TDS, turbidity, color, total hardness, total iron, sodium, potassium, fluoride, chloride, sulfates, nitrates, ammonia, and phosphorus. These are the parameters that we considered in the assessment and also in the computation of the water quality index. And we see that from our legend here, we have a scale ranging from 0 up to 100, and anything above 100 is unsuitable for consumption, and between 75 to 100 is very poor, 50 to 75 is poor, and 25 to 100 is good, then 0 to 25 is of excellent quality. So from the findings, we see that 18% of the water sources that we visited were unsuitable for consumption, and 10% were very poor. So you can see that people are just drinking water, yet is actually not suitable for their consumption. And only 36% was of excellent quality, 20% was good quality. What this result informs us is that only 56% of the water samples passed. They are the ones which should be consumed by the population there. But then about 44% of the samples are range from poor to unsuitable for drinking, and people should not be using such water. And the major contributor was the unsuitable water criterion was basically total iron. Total iron was the greatest contributor. In some sources, we found total iron as high as 16 milligrams per liter. Yet the standard of total iron is 0.3 milligrams per liter. So that shows you, while total iron is sometimes considered to be just for aesthetics, that the water will turn color, and then when you're cooking or when you're washing, the clothes will remain with some stains. But also very high concentrations of total iron might have some health implications when consumed without any intervention. And then we also found in some two instances the fluoride levels. Fluoride, FF is for fluoride. In two cases, where in Imvepi Primary School and Imvepi boreholes, we found that the fluoride levels were also high. And incidentally, this one I highlighted it because this is a school, a primary school, where we have young children drinking this water at break time, at lunchtime, and also taking some home. We have communities coming to fetch from this borehole, but the fluoride concentrations were higher and what is recommended by the World Health Organization for consumption. So these findings really show you that we really need intervention in these areas. We need serious intervention in these areas to make sure that the population is safe. The other interesting finding was the findings of Objective 2, where we are looking at the potential causes of pollution. And we use there's someone who is talking in the background. Can they mute? Ariho Modern, try to mute. Okay, as Ariho Modern mutes, let's continue. And this finding also on the possible sources of contamination, we basically use the World Health Organization sanitary surveys. And this one really doesn't tell us much, but gives us at least the probable cause of pollution of the water source, especially when it is coming from the sanitary aspects. Okay. Okay. Anyone here, Ariho Modern, can request them to mute. Okay, thank you. So from here we see that on the left hand we have the sanitary inspection frequencies for the hand pumps. So we try to break it down. We assess the hand pumps differently from the motorized boreholes, because in any case they have a different criteria. So from the assessment of the hand pumps, we noticed that 79% of the boreholes that we visited, they had the fence was missing or non-functional. And this has, of course, serious implications, because then animals will always access these point sources time and again, and to increase the rate of wear and tear, but also increase the chance of causing and spreading zoonotic diseases. And then 55% of the boreholes that we visited had blocked drainages or broken drainages, and this one increased the risk of ponding and pooling around the water source, which increase the risk of other vectors, disease vectors like mosquitoes, breeding in these areas and causing other diseases such as malaria. Then 55% of the water sources were had a latrine within 10 to 30 meters. Okay, and that one also increases the risk of having the matter in the latrines seeping into our groundwater sources. Then we had some others which had blocked drainage channels, a latrine uphill. So we had quite a number of these boreholes were about 48%, which were located in low-lying areas downhill of the settlement pockets. And this poses a risk of groundwater contamination from the pit latrines, since the pit latrines are uphill and then the groundwater sources are low-lying. There was potential for those for the groundwater within these boreholes being contaminated by fecal matter from the uphill latrines. Additionally, several boreholes were found to have inadequate drainage channels, like stated here. That's about 52%, and some of which were obstructed or broken, leading to stagnation in the area. And we see that only 6% of the boreholes had a cracked a mounting block, loose or cracked mounting block, which is good. So all in all, we see that we need the intervention in this area of the hand pumps. And for sanitary inspection score, for the motorized boreholes, the greatest risk we had was that 59% of the sources that we visited were near unsewered latrines. And then we also had about 47% other sources of pollution, like, like littered waste and dumping sites, and finding that these water sources are in low-lying areas in the valleys where they can easily be flooded and things like that, and also having the groundwater source sunk near a wetland, which is, so that means that wetland is recharging the borehole, and this wetland is in a low-lying area, receiving all the waste from the upstream. But on a lighter note, we found that many of these motorized boreholes, in their premise, they had eco-stand toilets, so which do not have a link to the groundwater aquifers. However, observed some few of these facilities having pit latrines and soak pits within the same premise. And this one causes, an immediate danger of pollution, an immediate risk of pollution to the groundwater sources, because if you have a soak pit just near where you obstructing, where you have sunk your borehole from, and this borehole is serving a very large community, that means that you're exposing that very community to the danger of the source that you're trying to pollute. Okay. And below here, we see the sanitary risk score categories for the different water sources. And they are categorized from very high to low. And if you look at the general one, where we have all, where we have the combined data for both the hand pumps and the motorized, we see that 4% of the water sources that we visited lie under very high risk category. And we have 16% under the high category, 44% under the medium category, and 36% under the low category. So what this means is that only 36% of the water sources that we visited don't require any intervention. The rest of the water sources that we visited need some level of intervention to make sure that the risks for pollution are lowered or minimized. And for the third objective, where we look at potential human health risk assessment, we use the incremental lifetime cancer risk for getting to know the probability of someone, getting or developing cancer due to long-term exposure of this water, of the water source. In our assessment, we noticed that most of the water sources that we assessed had some level of lead contamination, because the standard for lead is 0.01 milligrams per liter. That is both the World Health Organization standards, but also the standard for the East African standards for drinking water. It all puts the standard at 0.01 milligrams per liter. But we found that majority of the sources that we tested lied between 0.02 to 0.09 milligrams per liter. And that shows you that majority of them were beyond the required standard for drinking water. So then we computed the incremental lifetime cancer risks to tell us the probability of people developing cancer due to long-term exposure to the carcinogen. And in this case, we assessed lead and arsenic. Fortunately, for arsenic, we found that none of the water sources had detectable limits, detectable concentrations of arsenic. Otherwise, for arsenic, it would be very worse, because arsenic has a very high cancer stop factor compared to lead, which has a very, minimal cancer slope factor. So according to the UZEPA standards, the United States Environmental Protection Agency gives us a range that between 1 in a million people to 1 in 10,000 people, that is the safe range. So if your results fall within that range, that means you are safe. And then we see that for our results, all of them, they were within that range, and that means that they were all acceptable with respect to this assessment. But when we compared these results, our results, to other criteria that are being published time to time, we realize that actually, if someone depends on this water of long-term exposure to this water, may pose an intolerable cancer risk to both the children and adults. So these are some of the interesting findings that we found in this assessment. Okay. Before I go to the conclusion and recommendation, I'd like to kind of open an interaction to see if people have been following, or if there are any questions at this point in time, such that we clarify them.
No.
Was that you
Yes,
could check?
please. Hello.
Yes, please.
I have some comment from your slide 7. From your slide 7, you see we can show that the drinking water of the community of two communities is 18%. By the quality is 18%. Let's add which is unsuitable for consumption, for drinking, maybe cooking and drinking. So do you have data of other communities outside the settlements, the refugee settlements, or just on so that we can know that maybe the activities in the settlements are the ones causing pollution, or it is for both, it's for all, for the whole, maybe whole district or whole area?
Excuse me, members. Thank you. Can we let Barnabas finish, and then these questions will be put in forward after he has completed presentation? But currently, you can also post your comment and your questions in the chat, so that after presentation, Barnabas will be able to answer what is in the chat and what is going to come on as we proceed. Thank you, members. Barnabas, take in account that question, so that after presentation, be able to respond to the query from all the answers, all the questions from our participants. Thank you.
Okay, thank you, Madam Gwen, for your guidance. Let me proceed. And so in conclusion, you see that water quality and sanitation issues in refugee camps need to be addressed in order to have healthy living, and also to prevent long-term illnesses, especially those coming from heavy metal contamination. And these findings of this study emphasize the need for targeted interventions, because there are some areas where you really need specific interventions. Doing interventions that are targeting the whole area may not work, but if you target certain areas, then you can have good fruits. Such interventions lie within mainly category of infrastructure improvements, stakeholder collaboration to ensure sustainable water management. And part of the recommendations that we put forward is to strengthen routine water quality monitoring and surveillance, because through routine water quality surveillance and monitoring, you can get the data to tell you how bad the situation is, and to get to know which kind of intervention can be taken. Okay. And then we need to implement targeted source protection measures to mitigate contamination sources, because like you saw from the presentation, many of the risks of pollution arose from issues of, source protection. And we need to conduct community education and awareness. So without educating the community and without making it aware, then we are working on our own and we are not adding anything. So the community needs to be aware of the risks ahead of them and how best they can protect their water sources such that they get good water out of it. We need to do further assessments and further investigations to get to the bottom of the root cause of issues like lead, total iron, and fluoride. For example, fluoride is usually a geogenic factor. It comes from, the rocks. If the rock or the aquifer where the water is rich in the minerals of fluoride and total iron, then you find that, it might also be present in water. But other pollutants like lead and total iron can both be geogenic, but also they can also come from human activities, or they can come from the nature of the piping that was used in delivering the water. So that's why investigations need to be done to establish what is really the cause of the lead in the water. Is it the pipe or is it coming from the aquifer? Then when we know that, then proper remedial actions can be undertaken. So in the whole assessment, we noticed that the major drivers of the poor water quality were mainly lead, total iron, and fluoride. That is besides the biological, where we tested E. coli, and we also found that E. coli was there in some instances of the water sources, and recognizing that, E. coli just is a fecal indicator. It indicates recent pollution of the water source by fecal matter. But of course, with that, there's usually an easy intervention of, for example, boiling water, chlorinating it, and those are interventions that can easily be done even within the community. It just takes a little education of the masses, okay? But these other interventions require massive investment in infrastructure and also making sure that a lot of money has to be put in to treat the water. For example, if it is contaminated by lead and you don't want to look for an alternative source, then a lot of investments have to be done. That's why I'm emphasizing them in this recommendation. Then we need to do upgrading of sanitation facilities, especially those ones which are near the groundwater resources, to reduce the pollution risk, because we found that some of the water sources we are within 30 meters of the water sources, and those are the ones that we should target and maybe shift them or try to use alternative means of sanitation infrastructure. Ensuring proper maintenance of the structures, because like I've told you, other sources of pollution could be the pipings that are used, and these need to be changed whenever they start showing such tendencies of contributing the metals into the water. Then we need to implement water treatment and remedial technologies for high-risk areas. So I think this is the presentation. In acknowledgement, this assessment was conducted using funds from UNICEF, and the assessment was carried out by the Lila Regional Water Quality Laboratory, assisted by the National Water Quality Reference Laboratory in terms of, water quality analysis and assessment. And we also thank the Water Resources Institute for giving us the platform for presenting these findings. Thank you. I think now I'll open the floor to discussions as we proceed.
Thank you, Barnabas. Thank you for a very informative presentation, and thank you for the study that was carried out in cooperation with UNICEF, with the Ministry of Water and Environment, especially the Water Quality Management Department. Now, members, you are free to raise your hand and then you make a comment or ask a question of which Barnabas will be able to ask. I will allow a minimum of 5, and then Barnabas comes ahead to respond to them. Then we'll take another 5, and then we'll see how the time is going, and then we can proceed with the conclusion. Otherwise, thank you, Barnabas. Thank you, members, for attending and being attentive as we listen to Barnabas's assessment of the water quality and human health risk in the 2 camps in the Northern Uganda. Members, the floor is open for everybody to ask questions or make a comment. Thank you. You raise your hand. If you cannot speak, you can send your comment or question in the chat. Shall be able to follow up the chat also.
Yes, Madam Gwen, do you want to take the hand or
Can we
do
have Hannington? Hannington, go ahead, and then followed by Innocent. Thank you.
Thank you so much, moderator. I'm Hannington Ocheng, attending all the way from Bustema University, Tororo. Thank you for this nice presentation, Barnabas. I have a few questions to ask. The first one, I hope you are getting me over there. Hello.
Hannington.
getting you loud and clear, Hannington?
Yeah, the first one, you talked of some particular parameters and you indicated that they were actually, their values or other concentrations were above the limit. For instance, you mentioned total iron and then fluoride. But as a layperson, we would like to know what problems this kind of extreme values are associated with. What complications do these cause in human beings? For instance, when you talk of total iron, if the amount is higher than the expected limit, and then the fluoride. That is the first question. Then the second one, under hand pump borehole, you told us that the latrines were within 10 to 30 meters. So you as an expert, you should have told us that instead of having these latrines within this range of distance, we should be having them at this distance so that everybody should know what to do. It is not only the scientists who talk about it. Even the layperson should know that when maybe we are constructing our latrines, we should put it at this particular distance away from the borehole. That one I think would sound better. But you left that one also hanging. You just told us that they were within 10 to 30 meters and they were causing problems. So what have you told the layperson? The third one is also regarding lead, that lead was generally beyond the expected limit. So what do you really recommend here? What problem does it cause to a human being, and what do you really recommend here? Because some of your recommendations were just hanging; they were not specific. You are talking of further research or something, but you at this level you can still tell us something that when lead is beyond this value, beyond this concentration causes this, and we need to do this. So I can still stop there for the time being. If need be, I will again add more questions. Thank you so much.
Thank you, Hannington. Your chances are over. You've already asked 3. Let's have Innocent take in, because we need to allow everybody to at least to ask questions.
Okay, thank you so much. Thank you so much.
Welcome. Thank you, Hannington. Can we have Innocent, please?
Yes, please. Thank you very much, Mr. Barnabas, for your interesting presentation. It was enlightening and life-changing for everyone, because we all consume water. So you highlighted the high parameters, the iron, fluorine, and lead. They can all be from minerals, maybe underground, the geological setup of the rock, where if the water is coming from the underground, maybe it is from the rock or from the materials. If they're using boreholes, the materials they use, how long they use how long they take to change the material, to change the borehole materials they have used, that leave the residues in the what, in the soil, and end up in the what, in the water aquifers. Another thing, you said the protection system of the settlements is loose. Maybe they are not functioning. So did you take parameters from the places where animals or where animals come from into the settlements, and within the settlements, you can say maybe you can say the parameters inside the settlements are higher or lower than those ones outside the settlements. For example, so E. coli is very high in the settlements than low in the what, in non refugee settlements. So that we can have it, maybe high dense population makes this population means higher E. coli, and the rest population, maybe sparse population in the other communities makes it low concentration. So we cannot may either the whole community, both the refugees camps and and other communities have high pollution of what? Of both biological and physiochemical parameters of the water. Otherwise, thank you very much. I'm Innocent from Shanghai, but I'm Uganda.
Okay, thank you. I think Barnabas, you can, let's take these 5 questions, and then Barnabas can respond to them, and we shall take another set of questions. But I will request you members that when you are putting up your question, when you are posing your question, please try to be brief and to the point. If you, sometimes when you go beyond the point and talk so much, then the real question gets disappear in that talk. Please be brief and to the point. Thanks a lot. Barnabas, you can take this.
Thank you so much. Thank you for the questions. Hannington Ocheng, you asked the question, some parameters were above the guideline value, total iron and fluoride, and you're asking what is the health implication of this? Of course, for fluorides, we know that it causes fluorosis. Fluorosis is a disease that affects mainly your teeth and the bones. They become weaker if you continue depending on the water which has a lot of fluorides. And then for total iron is mainly looked at as an aesthetic parameter, in that when you wash for example, when you wash your clothes, when the water has high total iron, then it will, it will cause staining in the clothes, in the kitchenware or sinks and things like that. I think sometimes you've gone to places and found when a sink has developed some brownish color, and that's because that's one of the causes, that there's a lot of iron in that water. So that's one of the implications. But also for iron, we know that it's good for your health, but then there's what they call the recommended daily intake. So your recommended daily intake for iron should not exceed a certain value. If it exceeds that value, then you're bound to get some health implications. And the World Health Organization has put that at 18 milligrams per liter per day. And I think it's usually broken down for men have a different one, children have a different one, even women have a different one. So where it is taken as an aesthetic parameter, it also has some health implications if the total iron is very high in the water. Like in this assessment, there are some places where we went to, and there's a specific borehole, which had total iron as high as 16 milligrams per liter. So now that one raises a health concern, and that borehole is not supposed to be used by the people, especially for drinking. And you talked of, you also wanted to know the recommended distance between, for example, borehole and latrine. Okay, the World Health Organization has advised 30 meters for 30-meter distance between a borehole and a latrine. But also depending on the factors, if your borehole is supposed to be downhill and the latrine is upstream, this distance should even be increased to 100 meters. But if it's on a flat land, then 30 meters will do. And then you also inquired about the implication of having lead in the water. I also talked about this, but I can still repeat that lead is a carcinogen, meaning that it is a cancer-causing agent. So if you depend on water that has high concentrations of lead in it, then you're bound to develop cancer-related ailments. Then when I go to the questions raised by Innocent, I think the first was maybe a compliment. I don't know. It was a compliment to the presentation, and he was just adding something to the presentation. But he asked that if we had done an assessment to know if the water sources that were being accessed by animals had, maybe higher contamination than those ones that were not. That is one of the questions that I picked. And I would like to answer him that in this assessment, we are looking at, this one is already common knowledge. We know that if the animals access the same water point as a human being, then it increases the risk of that water source breaking down, or the risk of causing zoonotic diseases in case an animal has a disease and it can also be transmitted to a human being. The risk is higher if the water source is shared between the animal and the human being. I think those are the questions that we have so far. We could take another round of questions, Madam Gwendolyn.
Barnabas, also look at the chat and don't finish those questions in the chat, and then we can take another set of questions. There are questions already in the chat, if you can look at them.
Okay, thank you. We have a question from Tendo Mark. What do you advise on the water source protection for boreholes that are mainly recharged by wetlands and rivers? Okay, so we have we have water sources which are recharged by wetlands and rivers, and basically, like we said in the introduction, that groundwater sources are relatively safe, because groundwater sources, depending anyway on the depth, because we have groundwater sources which are deeper than 30 meters below the ground, and then we have those ones which are a bit shallow, less than 30 meters. Those ones we classify them as shallow, and those ones which are deeper than 30 meters, we classify them as deep boreholes. So, and then when you have a recharge from a wetland or a river, rivers and wetlands are usually in constant, these waters are usually in constant communication with groundwater sources, so they can easily be recharged by both the wetlands and the rivers. So when you want to do the source protection for these ones, that's when you look at the approach of, looking at the entire catchment. You look at the entire catchment, which drains into these rivers or these wetlands, and then you can be able to point out those areas which might cause pollution to the river or to the wetland, and then you deal with those. So I noted on Mark, here you have to go with the catchment approach, whereby you have to look at the entire catchment which is feeding these wetlands and rivers, that you reduce the risks of pollution to the wetland and rivers which are recharging your borehole. Then the other question is, how do the physical and chemical properties of groundwater vary between the two camps? I didn't get the difference the differences existing in the two camps. Okay, this is from Jasper Okino. Yeah, in this study, we didn't attempt to look at the difference between the two camps. We basically did the assessment as a whole to see if these two camps are relying on good water or bad water quality. But again, this one we can do with statistics to look at the difference between the two camps to see if Rhino has better water than Imvepi. It was not part of our objective. Yeah, but I think this is something also that we can look at. Okay. Then we have Bob Ogwal. Hello, I'm Bob. I would like to know the difference between iron and total iron. Also, does excess iron, lead, and fluoride have some effect on the body? I already answered part of this question, but maybe the difference between iron and total iron. I think this is not the right spelling of iron, otherwise it will mean something else. But I mean the iron, the I-R-O-N, iron and total iron. So iron occurs in different forms. It occurs in 3 actually forms, and all those forms can be tested. But when you do total iron, then you can look at the concentration of all the other forms in water. Okay, but iron has the similar implications, like I already discussed in the question that was asked by Huntington. Okay.
Thank you.
I think this question.
Thank you,
There's
Barnabas.
another one.
Another one down?
Yes, another one down says, thank you, Barnabas, for the presentation. Yes, in the chat. Okay, I work in Bidibidi refugee settlement from Yumbe. My question is, what simple testing method for water quality parameters our refugee communities can be trained with every point, and maybe possible simple treatment methods at water point of a community? Okay, thank you, Siraba Havizu from Bidibidi. So we actually have at Tawalabat, we have a package of training people on water quality testing and things like that. That's a full package of about 5 days. 5 days training on. So this training helps you to identify which parameters to test where and on which water source, and how you can plan on your analysis and things like that. And I can't cover all that in these few minutes, even the treatment options. So it's quite a wide range of things that we can talk about, because different water quality will require different treatment options, and yes, never cast in concrete. You'll find, for example, if there is high microbial load, you will go for treatment systems that are eliminating microorganisms like chlorination and things like that. But then when you find that maybe the water is hard or it has high minerals, then there are also other methods of filtration that can be used to make sure that these minerals can be recovered from the water before it is supplied from the people to the people. So your question is, yeah, it needs really, you need to be more specific in certain areas such that we get also a specific answer. Then another question from Bob Ogwal, does total iron, fluoride, and lead also affect animals and birds? Yes, for example, like it also affects the same, because we are all having the same living tissues, almost the cells have the same composition, and yes, they can affect other animals as well. For example, like lead causing cancer and things like that. It has a potential of bioaccumulating in tissues of other animals, and also in the food chain. So yes, the answer is yes to this question. So we can take some more hands, and then we move forward.
Thank you, Barnabas. I think you talked about that the simplest way of managing, for instance, if the water is polluted with biological content, or was it say like E. coli, the simplest way you can answer someone living in the Bidibidi, working in the Bidibidi, is to boil the water before you drink it. That's the fastest way you can do it, as well as you are planning to have a training from the water quality department to come and train you on other activities with respect to Bidibidi. At least another source of knowing that this water is contaminated, you can have also by using your eyes. Let's say you can, nobody can be telling you that the water has high level of iron. But when you pump it and you see it is brownish and it is not okay, then you say maybe there's iron. If it is hard and you put in soap, that one tells you that the water is hard. But for better understanding of the water quality and knowing how the simplest way of treating it, you would also get in touch with Barnabas. Barnabas is going to share with us his contact and see how they can help to do and help also to bring up to Bidbid and other camps within the northern area on how to treat and how to also to analyze that the water is not of good quality in terms of physical and in terms of bacteriological. The Ministry of Water works on a regional level so that we can have access, communities can have access to our services as Ministry of Water and Environment. That's why Barnabas sits in Lila, and the Lila takes the whole part of the Northern Uganda. So in case you want some assistance, you can want some help, you want some guidance, you can easily reach people in the Lila, the town, and they'll be able to help you as Minister of Water and Environment. So members, feel free to get in touch with Barnabas where other cases are required. Barnabas, there is Huntington again asking on a question on the chat. I don't know whether you can look at Huntington as wait for people to raise their hands. People and people who are attending, please raise your hands. Then we shall call on you. While Barnabas is looking at Huntington's question in the chat. For the fluoride, there are some things when I say, Barnabas, Huntington said, what are you advising for the case of high levels of lead, if I remember very well, one of these questions, and even fluoride levels. But Huntington, in case the water has high level of fluoride, fluoride is a very soluble element. And it may be so hard to remove fluoride from the water if it has high level fluoride that is dangerous, or it is a risk for human consumption. That well or that borehole can be decommissioned. That's the nearest way you can solve such a problem, because it is not like if you look at other elements, let's say iron can be filtered and becomes better, but fluoride is a very soluble element that may be complicated. Currently, I don't think there is a solution to remove fluoride in those waters. The only alternative is to close that borehole or decommission that borehole. But Barnabas, the floor is yours as you answer the questions in the chat. Members, you can raise your hand and then you ask more questions. Thank you.
I think what I see in the chat is not a question. This is Huntington, I think, begging to excuse himself from the presentation. Yeah. We can take maybe another hand or two, and then we proceed.
Okay. Seems everybody's satisfied. Are you satisfied with the presentation? No more questions? Let's give them just 2 minutes and see whether they are going to have someone asking questions. If there are no more questions, I just want to take this opportunity to thank Barnabas. Yeah, there is a hand from Edward. Peter Edmonds, please go ahead and ask your question. Peter, the floor is yours.
Hello, am I audible?
Hear you. Go ahead, Peter. We can hear you.
Yes. Thanks a lot, Barnabas, for the informative and elaborate presentation. I would also want to thank those who really gave you the funding to be able to conduct that assessment. On my side, mine may not be really questions, but perhaps maybe areas that we can explore in future on how such assessments can be made, I think better. There are a few areas that I notice which perhaps, I didn't see come through. For example, one is if we are not sure of where, the contamination, for example, of lead, I was concerned about the number of boreholes that, have lead contamination. The question that was going through my mind was how old are the boreholes? Because, okay, how old are they? Did you pick borehole numbers to be able, to know how old they are? Because at least from our database that can be got. But also we can get the other information about the borehole. Basically, to at least know the design and the construction and things like that. Basically, the other bit of the hydrology, the hydrogeology part that can help us, zero down to this. Then the other thing is that what happens now to those boreholes that, are contaminated. The aim of, carrying out such an assessment and given that it was funded by UNICEF, are they looking at, decommissioning some of these? Are they looking at maybe also improving the water quality of some of these? Because if I'm not mistaken, I think for lead, there are some innovations on how to perhaps, improve such water. Basically, you have to motorize the borehole and put some bit of a mini treatment system that can do that. So to me, for now, those are areas I would think about. But the other thing is, thirdly and last, is, the bit of composition of people who were actually, carrying out the assessment. Because I see it leaned more to the chemistry bit. But and some bit of social are there. But I think we needed, some more in-depth of linking now the sciences together. For now, those are my comments. Some of them seem to be questions. But I submit and thanks a lot. It has been informative.
Okay, thank you, Demands, for this submission. I mean, and yes, for the compliments, I take them in good faith, and I concur with you that actually this assessment, well, the scope was also a bit narrow. We are looking at only, the assessment of the quality of the water, and I concur with you that it should have actually been expanded to make more meanings, more analysis in linking the social aspects and maybe this other science of contamination, and then would have, a much more meaning out of it. But then even in the recommendations, I put that we need to do, some further assessments to get to the bottom of some of the contaminants that we find in water, because from this assessment, the way it was designed, and also, the resources that were available at the time didn't allow us to go into the in-depth assessment that, would have been required. And that is part of the recommendation that we made, that we need to do further assessments to get to the bottom of some of these sources of contamination that we had highlighted. And for the issue of how old the boreholes are, well, we collected, for all the boreholes, of course, we collected the borehole numbers. And I think, again, this is something that we can carry forward if we get any more funds to do a detailed assessment and get to know, we can use the borehole numbers and look into the database and follow up these boreholes and know when they were first constructed and first commissioned. And then we get to know their age, and then get to know also the design characteristics of these boreholes. So this again wouldn't be covered in the scope of this assessment. Yeah. Otherwise, thank you for your submission, and I take everything in good faith. Thank you.
Thank you. I think I just want to make a conclusion. Thank you, Barnabas. Thank you, members who have been with us since 11 o'clock. And we want to thank our presenter, for the good work that you have done. Yeah, he recommended more studies. This was a short-time study, short-time assessment, but this one can be expanded to include all the aspects that do affect the quality of the water, groundwater water quality. Like as Edmund has said, maybe you could have seen that maybe the boreholes were old, or the materials they use in the boreholes were don't cause lead, but you cannot know that until you've done more further studies to assess complete assessment of the causes of the variation in the water quality, especially with respect to physical chemistry. But we want to thank you, members, for being there. Water Resources Institute is inviting more people to embrace the monthly webinars that will always take place at the end of the last Friday of the month. Members, if you have some course studies, if you have come research, if you have got some small thing that you can share with the communities, you are welcome to express your interest to do a webinar with Water Resources Institute. The contact, you can easily, actually, Francis always sends out the invitation, but you can present, you can submit your EOI through that email that is always shared with you, the aspect of the coming in water and environment, Water Resources Institute webinars. The email is, I think it's wri.gg@gmail.com, where you can share your interest, and we as the Water Resources Institute staff will be able to capture it and schedule you to do your presentation. It is a very good platform where anybody in the world can listen in to what you've done, the studies you've carried out, and also suggest or propose and to improve on your research, or even something that we can adopt as Ministry of Water and Environment. Otherwise, I want to thank you all. Thank you for being around, and I wish you a blessed weekend. Bye-bye.
Bye.
Bye-bye, Winnie.